Okay. We're going to secure the IV using a chevron. Remember not to place the tape directly over the insertion site, but over the IV hub itself. Take your chevron, make sure your connections are tight, and then secure the J-loop portion at the rigid part of the catheter. In a real person, that won't pop up like that. Okay, so your IV's intact. The next thing you're going to do is apply your op site to give it a little more stability. Making sure that you can see the insertion site. And before we finish taping, we are going to take our blood specimen and fill our tubes. You're going to attach 20 gauge or larger needle. Insert it into the vacutainer tube, letting the syringe draw for the vacuum of the tube so you don't lyse the cells. And once your tube is full to the line where it's supposed to be full, it'll stop drawing the blood out of the syringe. You're going to set your tube down, discard your syringe, and then you can finish dressing your IV. Invert the tube gently a couple of times. I'm going to remove your paper. You're going to note the date, initials, and the size catheter needs to be on there somewhere. The dressing is also changed at the time of insertion, date, and my initials. And we're going to put this. I usually like to put this up here somewhere on the tegaderm, still making sure that the original puncture site is visible. And then I try to put my tape over top of my dressing so that it kind of protects it from the shower and other things. And then I tape this here at the rigid part as well.